new type of hip replacement is offering promising results for younger, more active patients. It's called hip resurfacing, and it helps preserve more natural bone and provides greater flexibility than traditional replacements. Here to explain how it's done is Dr. Sanjay Gupta. Dr. Gupta is an orthopedic surgeon at Danbury Hospital. Thank you so much, Dr. Gupta, for joining us. First and foremost, you have some prompts. You're going to show us how a traditional hip replacement works.
This is just a model which shows half a pelvis and a thigh bone, and the place where the ball and the cup meets, that forms the hip joint. In a traditional hip replacement, we actually cut the neck, and the head and the half of the neck is actually thrown away, and that gets replaced with a pin. The pin actually goes inside the thigh bone and holds the head. On the socket side, we place a metal socket into which traditionally a plastic bearing is made, and then these two comes together, and that forms a traditional hip replacement.
Interesting. Now, how about hip resurfacing? Can you show us how that works?
Well, in a hip resurfacing, what happens is you don't actually cut the neck anymore, and you actually preserve this much amount of bone, and all you do is resurface or just reshape the head, and then you put a cap, a metal cap, into it with a much smaller pin as compared to the big pin which we have in a traditional hip replacement. And that capping is just like putting a metal crown on your teeth, and that forms the resurfacing on the thigh bone side. And on the shell side, you have a solid metal shell which goes in together, and that forms your resurfacing.
Interesting.
Yeah, so the biggest advantage is the bone preservation.
Why is it important to preserve the natural bone?
Well, it is not a natural hip, it is an artificial hip. And with time, it doesn't last forever. With time, it has to be redone. And it has been shown in studies that if somebody who's 55, 50 years of age, and they have a traditional hip replacement, actually there's a chance that in 10 years' time, 10 to 15% of them would have to be redone because they failed due to many reasons. And in a traditional hip replacement, you already have lost the head and the neck, so you have lost the bone. Hence, there's very less bone left in order to play around to put a bigger prosthesis. In a hip resurfacing, you still have the head and neck preserved. Hence, if it was to be revised 10, 15, 20 years down the line, you still have the natural bone there. And theoretically, you can just take away the head and the neck and convert that to a total hip replacement.
Interesting. So actually longer lasting results, essentially.
Yeah.
What patients might want to have this done? Anyone who needs a hip replacement?
Well, it could be a fairly universal procedure, but there are certain limitations in the sense. Person who have weaker bone quality or osteoporosis, generally that weak bone doesn't sustain this metal implant. So certainly a word of caution there. And we try to put in people who are 65 and younger. And certainly, even if they are 65 plus or in 70s, if they have a very good bone quality, very active lifestyle and athletic, then certainly this is an option for them. We tend to also avoid in people who have kidney function failure or a potential for kidney problems like in diabetics, because this actually is a metal on metal bearing. It generates metal ions which has to be filtered by the kidney. So if the kidneys are not working properly, then the metal ions can build up.
Is the outcome of the recovery any different than with a traditional hip replacement?
For the first 6 weeks to 8 weeks, not really. There's not much of a difference in terms of the recovery. But the real difference is after 3 months to 6 months, because there are a lot of limitations with a traditional hip replacement, which a person can't do, because one of the problems with traditional hip replacement is that it can come out of the socket, anything to 1 to 2%. And in a hip resurfacing, it's virtually unknown for that hip to come out of the socket. So after about 3 to 6 months, the person can do any activities he or she wishes to do, to the extent that people had been running marathon after this.
Which amazing.
With a traditional hip replacement, we wouldn't advise somebody to run a jog.
How new is this technology, doctor?
Well, it has been around for good 40, 50 years, but the modern generation of hip resurfacing, one of the pioneers of which was in Birmingham, United Kingdom, which is the Birmingham hip resurfacing, has been around in 1997. And worldwide, especially in the United Kingdom and in Australia, about 65,000 has been done. But recently, only last year, it was being approved by the FDA in this country.
Wow.
And the demand and the popularity of this is ever increasing.
Now, do you think this is the future of a hip replacement?
Absolutely. This is the future, because people are getting young. People are younger, more active lifestyle, and this is certainly an option for that generation of people and patients, so that they can maintain their active lifestyle for the rest of their lives.
And it's being successfully performed at Danbury Hospital. Can
Absolutely.
you talk about that?
Yes, it's a very new procedure, so there are a very handful of surgeons and a handful of hospitals who offer this resurfacing in the country, and I think we are very privileged at Danbury Hospital and that we have this, and it's one of the few centers in the nation actually performing this procedure.
So it's actually not done in many places as of yet?
No. In fact, 6 or 7 months ago, there were only 5 or 6 orthopedic surgeons throughout the United States who were doing it. But certainly that number has been increasing over the last few months.
Why do you think that is? Does it take special training for someone like yourself?
Yes, it is a technically very demanding operation. It's completely different to traditional hip replacement. And because it's technically demanding, one has to have special training and expertise in order to do that. And I was fortunate enough to have this training in New York in Hospital for Special Surgery.
Fantastic. And how about in terms of your patients? Are they very open to this idea, or are they a little unsure of it?
Oh yeah, absolutely. They're open to the idea because the advantages are so many in comparison to traditional hip replacement. Everybody loves the idea of preserving their natural bone
Sure.
rather than losing it. And suddenly getting back to the active lifestyle, it's something one can dream of after a hip replacement, which they couldn't do after a traditional hip replacement. One of the other benefits is that this feels like a normal joint as compared to a traditional hip replacement. And there's certainly no limitations whatsoever after about 6 months to a year after this. They can do whatever they want.
Thanks again, Dr. Gupta. Well, coming up here on 12 on Health, promising a little less pain.
You don't get as much bleeding and bruising from it because you're not actually putting a needle through the tissues.
How a new device is making vasectomies a little easier to endure.